There's one other job that most people don't know about that is actually a very interesting and complex part of doing surgery, especially heart surgery. They're usually 3 feet or so away from the operating table and the anesthesia machine, and they're performing one of the most important functions that's necessary during heart surgery. So once the heart stops and the surgeons are working, they're the ones who are actually pumping the blood.
It is 2:15 in the morning. Inside a brightly lit cardiac operating room, the surgical team works under intense halogen lights. The surgeon makes a precise sternal incision, opens the chest, and then does something that sounds medically impossible. They stop the patient's heart. For the next 4 hours, that patient has no pulse, no blood pressure generated by their own organs, and no air moving in or out of their lungs. Yet, they survive. They survive because 3 feet away from the operating table stands a specialist operating a complex machine that temporarily replaces the functions of the heart and lungs. That specialist is the cardiovascular perfusionist. A cardiovascular perfusionist is a vital allied health professional who operates the cardiopulmonary bypass machine, commonly known as the heart-lung machine, during open heart surgeries, complex aortic repairs, coronary artery bypass grafts, and heart valve replacements. When a surgeon operates on a patient's heart, that heart must be completely still and empty of blood. The perfusionist attaches large tubes called cannulas to the patient's major blood vessels, diverting unoxygenated blood away from the body and into the heart-lung circuit. Outside the body, the machine routes that blood through an artificial membrane lung to add oxygen, filter out waste and air bubbles, remove carbon dioxide, adjust blood temperature, and administer precise medications directly into the patient's bloodstream. A mechanical roller or centrifugal pump then pushes that oxygenated blood back into the arterial system, keeping the brain, kidneys, liver, and vital organs alive while the surgeon operates. Beyond the traditional operating room, perfusionists manage ECMO, extracorporeal membrane oxygenation. ECMO is a specialized form of long-term cardiopulmonary support used in intensive care units for critically ill adult, pediatric, and neonatal patients whose hearts or lungs have suffered severe failure. In these critical cases, a perfusionist maintains life support for days, weeks, or even months at a time. Now let's examine the financial realities of this profession, because the income potential for a perfusionist is exceptionally high, particularly when factoring in the structural mechanics of hospital on-call pay. The baseline starting salary for a newly certified graduate cardiovascular perfusionist ranges between $140,000 and $150,000 annually. However, very few perfusionists earn only their base pay. For experienced clinicians, baseline salaries range from $170,000 to $210,000 per year. But because cardiac emergencies, such as acute heart attacks, aortic dissections, or traumatic chest injuries, happen at all hours, total compensation scales far higher through 3 primary operational mechanisms: on-call standby pay, call-in minimum payouts, and overtime accumulation. Mechanism number 1, on-call standby pay. Perfusion departments operate on continuous rotation schedules to ensure 24-hour coverage. When you are assigned to a call shift, the hospital pays you an hourly standby rate, typically $5 to $10 an hour, just to remain within a 30 to 45-minute radius of the hospital with your phone active. You are earning passive compensation while sleeping, spending time with family, or going about your personal day. Mechanism number 2, guaranteed call-in minimums and premium rates. When an emergency case occurs and your pager goes off, your standby pay stops and active call-in pay begins. Most hospital contracts guarantee a minimum payout, typically 4 hours of guaranteed pay, regardless of whether the emergency procedure takes 4 hours or 45 minutes. Furthermore, federal labor standards and hospital agreements mandate that call-in hours are paid at time and a half or double time rates relative to your base wage. Mechanism number 3, overtime accumulation. Open heart procedures are complex and routinely run past standard 8-hour shift boundaries. Because a perfusionist cannot simply switch off a heart-lung machine mid-procedure to clock out, staying late to finish a case is built into the job. It is common for a busy staff perfusionist to add $20,000 to $50,000 or more in annual overtime and callback pay on top of their baseline wage, pushing total annual W-2 earnings to between $220,000 and $260,000. Mechanism number 4, travel and locum. For clinicians willing to travel between facilities, the locum tenens marketplace offers some of the highest compensation packages in allied health. Travel perfusion packages routinely range from $250,000 to over $300,000 annually, frequently including tax-free housing stipends, per diem allowances, and travel reimbursements. To practice as a certified clinical perfusionist, a CCP, you must complete an accredited, highly specialized educational pipeline. Your educational program must be accredited by CAAHEP, pronounced CAAHEP, the Commission on Accreditation of Allied Health Education Programs. There are 2 primary accredited degree pathways. Pathway 1, the Master of Science in Cardiovascular Perfusion. This is a traditional 2-year graduate degree. It is designed for students entering directly after completing a bachelor's degree in a science discipline such as biology, chemistry, exercise physiology, or kinesiology. Pathway 2, the post-baccalaureate certificate. This accelerated pathway takes 12 to 18 months. It is specifically tailored for individuals who already hold a bachelor's degree, particularly those with prior clinical backgrounds as registered nurses, respiratory therapists, or radiological technologists, who want to pivot quickly into perfusion without taking on a full 2-year master's curriculum. Regardless of whether you choose a master's or a certificate program, clinical rotation requirements are strictly enforced. To sit for national board exams, every student must complete a minimum of 75 documented clinical perfusion cases under direct supervision during their program. Upon graduation, candidates must pass a 2-part national board examination administered by the ABCP, the American Board of Cardiovascular Perfusion, to earn their official CCP credential. Now let's detail the high-efficiency entry strategy, how to enter this profession with the least amount of wasted time, gain clinical experience rapidly, and position yourself to reach maximum earnings as quickly as possible. Step 1. Maximize prerequisite overlap. If you already hold a bachelor's degree in any science field, or if you work in healthcare as a respiratory therapist or nurse, do not waste time or money pursuing a second 4-year undergraduate degree. Focus exclusively on accredited post-baccalaureate certificate programs or accelerated master's programs that accept your existing anatomy, physiology, chemistry, and physics coursework. Step 2. Target high-volume clinical training sites. When evaluating accredited programs, review their affiliated clinical hospital networks. While board certification requires 75 clinical cases, students training within high-volume Level 1 trauma centers and regional cardiac institutes often log 150 to 200 clinical cases before graduation. Logging high case volume during school builds immediate clinical autonomy and makes you instantly attractive to top-tier surgical centers. Step 3. Strategic first job placement. Upon board certification, avoid taking your initial position at a quiet community hospital that performs only 2 or 3 elective cardiac cases a week. If your goal is rapid skill mastery and maximum earning potential, secure your first position at a high-volume regional heart hospital, a Level 1 trauma center, or a high-acuity pediatric cardiac unit. High-volume centers offer the heaviest call rotation schedules, the highest overtime volume, and complex ECMO workloads. Working in a high-volume center for your first 2 years allows you to collect maximum callback premiums while solidifying your clinical reputation. Step 4. Pivot to travel contracting or department leadership. After acquiring 2 years of high-volume clinical experience, you possess exceptional market leverage. You can transition into locum tenens travel contracts, taking control of your schedule while driving annual earnings past $250,000, or step into departmental management and private perfusion contracting groups. The cardiovascular perfusionist represents one of the most critical, high-stakes roles in modern surgical medicine. It offers extraordinary financial returns, job security, and clinical autonomy without the massive debt and lengthy timeline of medical school. All verified links to CAAHEP accredited perfusion programs, ABCP board requirements, and government wage data are provided in the description below, so you can research programs in your region right now. If you found this breakdown valuable, hit the like button, subscribe, and share your thoughts in the comments below.